Dreadf, Healthcare Stories. Ruth Kahn is being interviewed in an office at the Boston Center for Independent Living in Boston, Massachusetts.
Well, my name is Ruth Kahn, and I met Paul Kahn in 1980 when he was the editor of a newsletter in the disability community, and I was getting my bachelor's degree at UMass Boston. And Paul basically gave me my first writing job. So he and I co-edited this newsletter, and it was my introduction to the disability community. Paul and I had a lot in common. I would go over to his house and we would listen to the Mikado together. I mean, how many people can you do that with? I've always felt as if he was a soulmate. He stopped working on the newsletter a couple of years after I met him to pursue his master's degree in counseling at Northeastern. And at that time he was a visual artist.
A photograph of Paul Kahn viewing a sculpture.
As well as a counselor, as well as an editor, as well as a disability activist. And he was most involved in oils and sculpture and drawings. He was also, his health was really compromised. He had a rare neuromuscular disease, and he used a wheelchair all of his life. 7 years after we met, he started having major health problems, and it turned out that he was addicted to major levels, to very high levels of carbon dioxide, which was keeping him alive in a weird kind of way. So the doctors finally would not let him leave the hospital until they figured out what to do about this situation. And Paul was reluctant to go on a ventilator. He felt with all of the stereotypes that most people think about using a ventilator, it usually means the end of life. And needless to say, it turned out that using a ventilator was the beginning of a new phase of Paul's life. The other really wonderful thing at that time was that a respiratory therapist was willing to work with Paul to recirculate the air that he was using so that he could have continuous speech. A lot of people who use ventilators, there is a break between their inhaling and exhaling, so that they're easily interruptible. And with Paul, he could not be interrupted very easily because he was on a continuous flow of air all the time. So this really helped him to be able to do the counseling that he was doing, as well as public speaking. We were married for 21 years. It's true. The political is the personal, is the artistic, and the integration of all of that in our lives. Paul enabled me to grow as an adult in so many ways, so that my independent living blossomed at the same time as the independent living movement in many ways. There were metaphors all over our lives. In 1990, he was invited by the Institute of Thanatology, which is the science of death, to give, they were focusing on patients with ventilators. So he was invited to Columbia University to give a talk, which he entitled "An Astronaut on Earth," about his relationship with the ventilator, and how he felt like as if he was tethered to the machine in the same way that an astronaut would be tethered to a tube for breathing out in outer space. And Paul's health generally was very, very good for the first 15 years of our marriage. And he was on the ventilator continuously, obviously. However, in 2007, his health started to decline. And as we found out much later, because of the constant use of the ventilator and the trach tube that he was using, the walls around his trachea were basically collapsing. So it was causing him to have more and more pneumonias and to spend more time in the hospital. Paul had been used to using one kind of ventilator for 15 years. And when we first started to have to go to the emergency room, after he was finished after he was evaluated in the emergency room and they would want to admit him to a room as an inpatient, we were stuck in the emergency room for 9 hours because two different floors were fighting. They did not want to admit Paul because they knew that he wanted to use his own ventilator. He was not, and to me, hell is an emergency room. I now know what hell is. It's in an emergency room, in limbo, not knowing how my husband is going to be taken care of while two different floors fight over him. Once he was admitted, it was, since I know his medical care more than the staff of the hospital, I was assuming that I would be able to cooperate with them in providing Paul with the suctioning and the different medical care that he needed. However, the nurses saw me as more of a hindrance than a help. If the nurse was uncomfortable in using a ventilator, they would insist that he use the hospital's ventilator, although that caused him great discomfort and anxiety. In fact, one day, I insisted that our attendant go to the car and get our ventilator because Paul was so uncomfortable and nobody was listening to him. So we hooked up the ventilator, and the head nurse came in and looked at what was going on, and she freaked out. And while she was freaking out and some other nurses were in with her, Paul needed suctioning, so I went ahead and suctioned Paul, whereupon the nurse told me that I needed to leave now. So I was kicked out of the hospital for taking care of Paul. So eventually, with the help of Paul's primary care physicians, the hospital had a contract with the ventilator company and had their own model of Paul's ventilator at the hospital for him. And the respiratory people were trained in how to use that ventilator. However, since there are no policies and procedures in place about the use of the ventilator, with the rotating nurses all the time, we never knew from one minute to the next whether he would be actually allowed to use the ventilator. Nothing was centralized, nothing was, no policies were in place. Paul had numerous hospitalizations from 2007 until 2009. And for every hospitalization, he was putting his life on the line because we never knew whether the nurses would be able to allow him to use the ventilator and whether they would pay attention to him, to what he had to say about whether he needed to be suctioned, and whether they would allow me and his attendants to suction him and take care of him in the way that he needed to be taken care of. So Paul always felt as if he was risking his life whenever he entered the hospital. The hospital perceived Paul as being a helpless blob. There's no other way to describe it. They didn't think he had a brain in his body. They didn't think that they needed to pay attention to him at all. They thought that they knew best, that they knew what Paul needed. And this was so not the case. There should have been a hospital policy in place so that whenever Paul was in the emergency room waiting to go to be admitted as an inpatient, the ventilator at the hospital should have been located very easily, and he should immediately have been hooked up to that ventilator. In addition, the hospital should have allowed Paul's attendants and me, and Paul's and my direction, to provide Paul's respiratory care because we knew more than anyone else how to provide that care. There were very often times when Paul was hospitalized when there was not an accessible call button available for him. There should always have been, the staff should always know where that call button is and how to get it to Paul as soon as he is on the floor. So from little things to huge things, Paul was always risking his life when he was in the hospital. An interesting side note to this is that Paul, the person who was Paul's final primary care physician, looked at Paul's history and looked at Paul in hospice and said, "Why are you in hospice? You've survived all of these other things. Why are, you know," and we all looked at each other and said, "We've wondered the same thing." So fortunately, Paul was not in hospice at the end of his life. He was on various medications and on various feeding tube situations and lots of other things that Paul's attendants and I were able to manage. And Paul was writing and being active right up until the end of his life at home. So it was such a contrast from the experiences that we had had in the hospital, where he was not in control at all of his own care or his own life. Paul was used to being the master of himself. He was used to directing his own care. I feel as if we did have a success story. I remember when Paul had some very creative surgery where they inserted a stent into his trachea to widen the opening, and that way they could put a trach tube down which fit into the stent. It was remarkable surgery that they were able to do. And when I was meeting with the surgeons about this procedure, I said, and I'm assuming that we're all on the same page about the eventual goal being for Paul to come home. And they looked at me as if I had two heads. I think that they thought that this was the end of Paul's life and that he would never be able to go home, that he would be winding up in a rehab center for the rest of his life. It never occurred to them that he would be going home. So once I planted their idea in their heads, fortunately the surgeons were able to be more creative, and we all had that goal of Paul being able to go home. I would love hospitals to be a place of patient-centered care, where durable medical equipment follows the patient wherever the patient is, whether it's in the hospital or whether it's visiting a conference or going on vacation or simply living at home. I would love a primary care physician and the patient to be in charge of the care that the patient receives in the hospital. And I would love for the staff to collaboratively work with the patient and the family to provide the best care possible while the patient is in the hospital. It appalls me that people are still facing so many challenges. People with disabilities in particular are facing so many challenges when they enter a hospital. And a place of healing should not be a place of imprisonment. And we felt as if we were imprisoned whenever we went to the hospital. And I know many other people with disabilities feel the same way. If I had the opportunity to corner a chief executive officer in an elevator of a hospital, I would be tempted to say many, many things. However, the most important thing I could say to him is, look, we are all human beings on this planet. We are all on the same journey. Let's all cooperate to provide the best care possible for ourselves and our loved ones. Listen to your patients. They are the experts of their own medical care.
A photograph of Paul and Ruth at their wedding, and a photograph of Ruth in her wedding gown.
Well, Paul and I, when we were married, we were very fortunate because we were both in the theater. So we treated our wedding as a theatrical event. The first act was the ceremony. The second act was, then there was an entr'acte where people had a chance to greet us, the mighty couple. And then the second act was the reception. We hired a kick-ass jazz band to be our reception band, and our song was "Our Love Is Here to Stay." He was amazing. He's perched on my shoulder, on my left shoulder, and Paul's parents are perched on my right shoulder. They're with me always. Paul died on January 1st, 2010, on New Year's Day. It's a great relief to be able to say these things to a really wide audience. And I know that we're not alone in these feelings, and it's wonderful to be able to reflect back and mirror the disability community in our own lives. And it's a great privilege to be a part of all of these lives.
Healthcare stories. Made possible with generous support from the Manuel D. and Rhoda Mayerson Foundation. Ruth Kahn was interviewed at the Boston Center for Independent Living, July 2011. For more information, visit the Disability Rights Education and Defense Fund website, dredf.org/healthcare-stories. This work is licensed under a Creative Commons Attribution Non-Commercial Share-alike 3.0 Unported license.